Good evening.
Good evening. Can I see your candidate number, please?
Yes, it's my candidate number.
399. Okay. This is your patient. You can proceed. You read the instruction outside, right?
Right. Good evening.
Good evening.
Hello, my name is Muhammad. I'm one of the surgical doctor. May I confirm your name and age for me, please?
Yes, of course, doctor. My name is Anderson. My age is 66 years old.
Nice to meet you, Mr. Anderson. How can I help you today?
I have this severe headache, doctor. It's I had a car accident 2 days ago, and from that time I have severe headache. I think you can see it in the records. Until now, it's bothering me.
I'm really sorry to hear that, Mr. Anderson.
Thank you.
Could you tell me the exactly site of the pain?
It's all over my head, and it's like beating headache, and it's very, very, very severe. If you can prescribe painkillers for me. This is the
Could you
worst.
tell me?
This is the worst headache I ever had.
I can see. It is a tough situation that you pass through, Mr. Anderson.
Yeah, it is.
Is there anything make this pain increase or decrease?
Yeah, I think noisiness and lights will increase my pain, and if I'm in a calm room, that will make it better.
Do you would like for me to dim the light?
Yeah, of course, yes.
Is this headache present all the time or come and go during the day?
All the time. After the accident, it's present all day long.
Being worse?
It's present all the time. Yeah, and it's getting worse, yes.
Okay, Mr. Anderson, let us score this pain. If I say that 1 is the lowest pain and 10 is the highest pain, how would you score this pain?
12.
Really sorry to hear that, Mr. Anderson. Okay, Mr. Anderson, did you notice any unintentional weight loss or general tiredness?
No.
Any vomiting?
Yeah, I had vomiting in the last day, but it happened just once.
Okay, Mr. Anderson, is it a forceful vomiting?
No, it's not a forceful, it's just normal vomiting, no.
Did you notice any weakness or numbness in your lower limb or body?
No, I didn't notice any of these, no.
Is there any neck stiffness?
I think I have neck stiffness, yes.
Have you had a fever?
No.
Any change in your skin color?
No.
Any jaw pain, Mr. Anderson?
Jaw pain, no, I don't have jaw pain, no.
Any problem in your vision?
No problem in my vision. It has been okay.
Any diagnosed by other medical condition?
Yes, I have diabetes.
I'm sorry to hear that. When you diagnosed by this diabetes?
6 years ago.
What type of medication that you take for this diabetes?
I take metformin, and I take another drug. I don't remember right now, but I take 2 drugs.
Any history of surgery?
No, I don't have any history of surgery.
I can see. Regarding to your family, Mr. Anderson, is there any one of your family has a similar condition or diagnosed by other medical condition?
Yeah, my granddad has migraine, but otherwise we don't have any familial disorders.
I can see. Do you have any allergy, Mr. Anderson?
No, I don't have allergies, no.
Now I want to ask you a personal question. Is that okay, Mr. Anderson?
Yeah, that's all right, doctor.
What do you do for a living?
I'm a carpenter.
Who live with you, Mr. Anderson?
My wife and my son.
Did you experience any difficulty with steering?
No, I didn't.
Do you smoke, Mr. Anderson?
Yes, I do.
How many cigarettes per day?
You can say around 10 cigarettes a day, yes.
Do you drink alcohol?
No, I don't drink alcohol.
Okay, Mr. Anderson, who do you think the cause is?
I'm sure it has something to do with the accident, because I didn't experience this headache before. It's just after the accident.
Is there any concern?
I have concern, yes. Like, I'm afraid this headache will never go away.
Don't worry, we will take care of you.
I hope so, doctor.
Okay, Mr. Anderson, is there any shortness of breath, chest pain,
No, I don't have this, no.
tummy pain, or difficulty in urination?
No.
Okay, Mr. Anderson, we have reached to our end. I reached to our end of my question. Do you have any question for me?
No, that's all, doctor.
Thank you so much, Mr. Anderson.
Okay. Present your patient.
I took clinical history from this gentleman, 66 years old, diabetic, on metformin. He came presented with headache after car accident 2 days ago. He described this headache is the most severe headache in his life. There is no symptoms suggest neoplasm or malignancy. No symptoms suggest encephalitis or meningitis. No symptoms suggest giant cell arthritis. As I mentioned, as a past medical history of trauma 2 days ago.
Okay, that's okay.
And
so you have a gentleman, 65-year-old, presented with a severe headache. He described it as the worst headache in his life. 2 days from his car accident, right? And you excluded couple of pathologies. So
Right.
what do you think the most appropriate diagnosis?
My main diagnosis is subarachnoid hemorrhage.
Okay, subarachnoid hemorrhage. And what made you think about subarachnoid hemorrhage at the first and main diagnosis?
He had a past medical history of trauma,
Okay.
and he on acute severe headache
Okay, and he didn't have any symptom
and
before
vomiting.
before the accident, right? Okay. So what's other differential that you need to consider? Also differential diagnosis.
Also, I will consider migraine headache, encephalitis, meningitis,
Okay.
giant cell arthritis, and brain tumor.
Okay. Let's hypothetically think this patient has giant cell arthritis. What's the most important thing that you need to give for him as a treatment?
Yes, I will give the patient steroid prednisolone. Yes.
Why? To prevent what the side effect of giant cell arthritis?
It may cause blindness.
Yes, to prevent blindness. That's the most important thing. Okay. This patient, you said your most important diagnosis and your main differential is subarachnoid hemorrhage. How are you going to treat this? How are you going to first investigate this patient?
I will consider CT head
Okay.
to exclude any cause of brain tumor, subarachnoid hemorrhage.
Okay.
After that, I will request an blood investigation as a full blood count to estimate hemoglobin, white blood cell, urea and electrolyte, serum potassium, serum calcium, phosphate, and serum sodium.
Okay, and the most important investigation for you, you mentioned it at the start.
Is a CT head.
Okay. Okay, how are you going to treat your patient, doctor?
I will treat my patient after discuss with my treatment with a multidisciplinary team, including neurosurgical consultant and neurosurgery and ITU registrar.
Okay.
I will start by resuscitation of the patient, giving him fluid and oxygen. Also, I will consider a nimodipine. 60 oral nimodipine, 60 milligram.
Why you want to consider nimodipine?
Because nimodipine will prevent vasospasm
of the arteries. Okay. And what's the mechanism of action of nimodipine?
Calcium channel blocker.
Calcium channel blocker. Do you have any aspect for the treatment, or that's all?
Yes. No. I will consider any borehole operation and craniotomy if needed.
If needed, okay. That's all for this station. You can go to the next station.